Session 4 of NURS 238, Classification and Management of Mental Disorders. This session we are looking at the pervasive developmental disorders. So we are looking at pervasive developmental disorders. At the end of the session, the student will be able to identify the pervasive developmental disorders. Pervasive developmental disorders are characterized by pervasive and usually severe impairment of reciprocal social interaction skills, communication deviance, and restricted stereotypical behavior pattern. This category also is called autism spectrum disorders. So pervasive developmental disorders are also called autism spectrum disorders and includes autistic disorder, Rett disorder, childhood disintegrative disorder, and Asperger's disorder. But for this class, we only look at autistic disorder. That is autism. So let's look at autism. Autism is the best known of the pervasive developmental disorders. It is more prevalent in boys than in girls. 4 out of the 5 autistic children are males. 80% of cases of autism are early onset with developmental delays starting in infancy. The other 20% of children with autism have similarly normal growth development until 2 or 3 years of age, when developmental depression or loss of abilities begin. They stop talking and relating to parents and peers and begin to show symptoms of autism. Current estimates suggest that 1 in 1,000 to 1 in 500 U.S. children from 1 to 15 years age have autism. This is from National Institute of Child and Human Development, NICHD 2002. What are the causes of autism? Biological studies. Autistic children have abnormally high levels of the neurotransmitters dopamine and serotonin. So dopamine and serotonin in autistic children are high. What about their role in the development of autism? These two neurotransmitters, dopamine and serotonin, may play a role in its treatment. When autistic children receive stimulants such as the amphetamines, which increase dopamine, their symptoms of hyperactivity, ritualistic behavior, and self-stimulating get worse. Dopamine-inhibiting drugs such as phenothiazines mitigate many of the symptoms of autism, including self-mutilation and repetitive motions. 2. Congenital disorders, that's birth complications. Some cases of autism seem to involve congenital disorders. 8 to 10% of children who had congenital rubella, that is German measles, are autistic. In a recent study of identical 17-year-old triplet boys who had a mild form of autism, researchers found that although the boys were generally quite similar, the severity of the problems differed. The triplet had weighed at least at birth, the triplet had weighed the least at birth, had been slightly blue and needed oxygen, and had stayed longest, that is 4.5 weeks, in incubator. At age of 1 year, had pneumonia and again was in the hospital. This time, for nearly a month, the triplet with the least severe problems weighed the most at birth and had the fewest problems after he was born. This study supports the hypothesis that birth complications and problems in infancy are implicated at least in the severity of autism. Genetic research. There are few genetic twin studies of autism because it has been difficult to find enough samples of twins. Researchers found 11 pairs of monozygotic twins and 10 pairs of dizygotic twins in which at least one twin was autistic. Even though there were a few setbacks, such as several of the autistic children suffering from brain damage at birth, making it difficult for the researchers to say what extent their impairment was inherited. Despite these drawbacks, however, the study suggests that autism has some genetic component. Many children with autism have a relative with autism or autistic traits, autistic that have a genetic link. So it is familial or it is inherited. We continue with the causes. Social environment. The proponents of this theory suggest that autistic disorders is caused by the parents and the social environment they provide. Some of the specific causative factors proposed in these theories are parental rejection, family breakup, family stress, insufficient stimulation, and faulty communication patterns. One of the first theorists to espouse this view was Leo Kanner in 1973. In his studies, he described the parents of autistic children as well-educated, upper-class individuals involved in careers and intellectual pursuits who were aloof, obsessive, and emotionally cold. The term refrigerator parents was coined to describe their lack of warmth and affectionate behavior. However, because Kanner's studies also showed that many parents of autistic children also have children without the disorder, and other parents who could be described as aloof produced no autistic children, he came to believe that autistic disorder have no single cause. He believed that children must have a predisposing biological condition that combines with the unfavorable social environment and gives rise to autistic behavior. 4 symptoms. What are the symptoms of autism? We are going to discuss 4. So 4 symptoms are present in any child diagnosed with autism. Social isolation is one of them. Cognitive deficits is another. Language deficits, and finally, ritualistic motor behavior. Let's start with social isolation. Many autistic children essentially withdraw from social contact into a state of what has been called extreme autistic aloneness. As infants, they do not demand attention from others, an unusual trait in a baby. They avoid looking anyone in the eye and may even act as if other people do not exist. They do not relate to peers or parents. They lack spontaneous enjoyment and cannot engage in play. They have apparently no moods or emotional affect. If they show some at all, they may exhibit rage, panic, or inconsolable crying. Cognitive deficits, the second symptom. Most autistic children are mentally retarded. About 70% have an IQ less than 70. Autistic children do quite a bit better, for example, on tests of sensoromotor abilities such as finding hidden figures than on tests of social understanding. They cannot see the world from another point of view. The third symptom is language deficit. More than half of all autistic children do not speak at all. There is little intelligible speech. They babble, scream, or simply echo what other people say. This is called echolalia. Some autistic children aimlessly repeat snatches of songs, television commercials, or other bits of overhead language. Those who speak can communicate only in a limited way. Autistic children cannot engage in the usual give and take conversation, cannot communicate reciprocally. Children most likely to benefit from treatment have developed some meaningful speech by age 5. The next symptom is ritualistic motor activity. Most autistic children tend to repeat a limited number of movements endlessly, ritualistically, and without any clear goal. Examples are hand flapping, rocking, head banging, hand biting, pull out of hair, otherwise called trichotillomania, bite of the ends of their fingers, chew shoulders down to the bone, often crying out in pain as they do so. Left to themselves, most autistic children, especially those who are institutionalized, spend as 90% of their time in these bizarre forms of self-stimulation, some of which cause physical harm. The urge to perform these strange motor behaviors is apparently very strong. Preservation of sameness, the last symptom. Autistic children are usually anxious and obsessive about keeping their surroundings utterly unvarying. Toys must be kept in the same place, on the same shelves. Breakfast must be an unvarying ritual of egg first, vitamin pill second, and then toast. If the child senses that any step has been skipped, he or she may respond with temper tantrums. Autistic traits persist into adulthood, and most people with autism remain dependent to some degree on others. They have language problems and poor social adjustment. Social skills rarely improve enough to permit marriage and child rearing. Adults with autism may be viewed as odd, or they may be given a diagnosis of obsessive compulsive disorder, mental retardation, or schizoid personality. How do we manage autistic children? They do well on phenothiazines, drugs that reduce serotonin, also hold promise. In one study, for example, fenfluramine, which reduced serotonin, was given to 2 autistic boys, a 3-year-old and a 5-year-old. For 3 months, both improved noticeably in their speech, social behavior, and IQ scores. The 3-year-old IQ nearly doubled. When the drug treatment was stopped, these gains held for at least 6 weeks started to diminish. In recent times, antipsychotics such as haloperidol or risperidone are effective for specific target symptoms such as temper tantrums, aggressiveness, self-injury, and hyperactivity. They have tried orthomolecular therapy, which involves special diets, especially low carbohydrate diets, and megavitamins therapy, example, large doses of vitamin B6. Autistic children have relatively improved on special diets. How do we nurse autistic children? If they have problems of mutilation for lack of nurturing, work with the child on one-to-one basis to establish trust. Try to determine if the self-mutilative behavior occurs in response to increasing anxiety, and if so, to what the anxiety may be attributed. Mutilative behaviors may be averted if the cause can be determined and alleviated. Try to intervene with diversion or replacement activities and offer self to the child as anxiety levels start to rise. The activities may provide needed feelings of security and substitute for self-mutilative behaviors. Protect the child when self-mutilative behaviors occur. Devices such as helmet, padded hand, or arm covers may provide protection when the risk for self-harm exists. When the child has problem with social interaction, assessing a limited number of caregivers to the child, ensure that warmth, acceptance, and availability are covered. These characteristics, along with the consistency of establishment and maintenance of a trusting relationship, provide child with familiar toys or a blanket. Support child's attempt to interact with others. Familiar objects and presence of a trusted individual provide security during times of distress. Give positive reinforcement for eye contact with something acceptable to the child, example, food, familiar objects, etc. Gradually replace with social reinforcement, example, touching, smiling, and hugging the child. Being able to establish eye contact is essential to the child's ability to form satisfactory interpersonal relationships. If the child has a problem with verbal communication, maintain consistency in assignment of caregivers. Consistency facilitates trust and enhances the caregiver's ability to understand the child's attempt to communicate. Anticipate and fulfill the child's needs until communication can be established. Minimize frustration while the child is learning communication skills. Seek clarification and validation to ensure that intended message has been conveyed. Give positive reinforcement when eye contact is used to convey nonverbal expressions. So we have come to the end of mental retardation. So we have looked at the levels, we have looked at the forms, and we look at how to treat somebody suffering from mental retardation using the nursing process. Thank you.